I'm going to be completely transparent now. A few weeks ago, we were discussing OCD on the show, and we got a message from a dad saying that their daughter had experienced some symptoms of OCD, but was actually diagnosed with PANDAS syndrome. This was the first time I had ever heard of this. So we invited him on to talk about it. Thierry's daughter was 12 when she had PANDAS back in 2018, and we're going to be speaking to him shortly. Before that, though, we're going to get the medical side from Dr. Girish, consultant paediatrician at Saudi German Hospital. Dr. Girish, this is where I'm going to completely sound like I've never spoken to a doctor in my life, because I'm completely ignorant to this condition. And as a parent, it's something that I feel like we should be tuned into what's going on in terms of this. So what is PANDAS, and what does that acronym actually even mean?
Yeah, thank you, Helen, for inviting me.
You're so welcome.
And so PANDAS is basically an acronym, PANDAS. So it stands for Pediatric Autoimmune Neuropsychiatric Disorder associated with streptococcal infection. That's what PANDAS, PANDAS stand for.
So strep?
Yes. So what happens is basically, if you have a strep infection, 99.9% of the kids clear the infection without any issues. But small percentages of children, when they produce antibodies to the strep infection, the same antibodies misreads some of the antigens in our brain and starts attacking that part of the brain. So that is when this syndrome appears, and it generally appears, it's not very common disease, but it is not uncommon either. And it typically affects children in the age range of 3 to 12, 13 years. After 12, 13 years, it is quite rare. It can happen in adults, but very, very rarely. And the way it presents is very dramatic. That's what is very scary about, you know. I mean, they suddenly overnight, or when they get up in the morning, kids can have obsessive-compulsive behavior, tics, and sometimes they can have anxiety attacks. Sometimes they can be depressed.
Literally overnight?
Yes. It is usually dramatic presentation.
Sudden.
Yes. It is not like OCD of a psychiatric nature, where it usually begins slowly and insidiously. Whereas in this, because it is an antibody-mediated reaction, it happens all of a sudden following streptococcal infection.
Have you had many cases come into clinic?
It is not very common. So, I mean, I should say I'm not an expert in this, but I have personally seen 3 cases of PANDAS in the over last 20 years. So overall, in general, it is quite rare. But part of it is also because now, over the last 25 years, we are increasingly recognizing it. In the sense, it was only reported in the late 90s. Oh, the first case report was actually in 1998.
Is it often misdiagnosed then, doctor?
True. It is also, underdiagnosis is also there, and sometimes overdiagnosis is also there in terms of, for example, not all OCDs are related to PANDAS. You have a lot of OCDs which are typical psychiatric disorder, but when an OCD happens suddenly in a child, definitely PANDAS need to be thought of.
Can I ask you about, I guess there's the physical symptoms and the emotional. Can you explain a little bit more about some of those? You mean talking there about the kind of the psychiatric manifestation. Are there any physical symptoms as well with PANDAS? Yeah,
so that is a difference between, for example, if you have a meningitis or an encephalitis, you have a lot of physical symptoms, whereas in PANDAS is mainly psychiatric symptoms. They come with sudden onset obsessive-compulsive behavior, tics, and also sometimes related to food intake. Typically, child suddenly changes the behavior of, food intake, and lack of sleep, and anxiety attacks, and depression. So any of these spectrum of symptoms can happen.
And then what about treatment?
Yeah, treatment is basically this is a reaction to a streptococcal infection. So we need to treat the streptococcal infection with antibiotics. Mm-hmm. And also because there is an immune reaction against particular part of the brain, we need to have an immunosuppressive therapy, and typically it is steroids. And sometimes they may not respond to steroids. Then we go to what we call as immunoglobulins, which is a next level of treatment if the steroid fails. And even if that fails, sometimes what we do is plasmapheresis, which is basically you take out the antibodies from the blood and infuse with fresh plasma. But the percentage of children who require plasmapheresis for this particular illness is quite low. So most of them, as dramatic as it presents, most of them actually dramatically respond to steroids too.
Now, this was brought to our attention by Dubai Dad, and Thierry joining us now, explaining what happened to your daughter Alexandra back in 2018. Thank you so much for being with us and as I said, raising awareness around this topic. When did you first think that something was not right with your girl?
Well, it was pretty much exactly 5 years ago. So it was around the 20th or the 22nd of August 2018. We just landed in the UAE from the US. We were just getting ready for school. And then absolutely from one day to another with, no warning. Our daughter couldn't do 2 steps forward without doing 2 steps backwards. And suddenly it would take her probably 5 to 6 hours of preparation before going to bed.
Is this relating to some of the OCD type symptoms that Dr. Girish was outlining? So this was her wanting to do certain things, have certain behaviours in order to feel lack of anxiety. What was she doing?
Yeah. It's to deal with her own anxiety, but she never had any OCD symptoms before, ever. And from one day to another, it was very severe, to the point that after a couple of days, she would not leave one room. And a few days later, she wouldn't leave the corner of the couch. So she basically were not able to go to school, and she missed 1 full year of school. And it was terrifying.
What came to mind in those first few days in terms of where has this come from, what could this be, and what did you do in those early stages?
Well, we thought it's probably a reaction to the move itself, and we consulted a lot of physicians, and we were not really helped at that time because people were like, well, this is OCD. It's a long treatment. And, what was for us, the fact that it came from one day to another, we thought that something else is triggering it. But our child was in such distress, certain point wanting to shave her head. It was very, very scary that we couldn't really even get her out of the house. So, it actually took it took until Christmas of that year where we managed to get her on the plane to go to the U.S. to see an expert, an expert in mental disease, not an expert in PANDAS.
So tell us then, that seemed to be the misdiagnosis you were hearing time and time again. It was a psychological issue and condition, not really digging any deeper into where this would have come from. And Dr. Girish is explaining there about the strep. When did you first hear the phrase PANDAS syndrome, and when did the puzzle pieces start being put together?
So we flew back to what was home before, and we were talking to some friends, and someone told us that, have you heard of PANDAS? And I said, of course, no, I have never heard of PANDAS. And they mentioned that the most famous expert doctor for PANDAS is actually in the Washington, D.C. area. And we tried to get an appointment. It was very hard. My wife was actually sitting all day in front of in the lobby until she got an appointment, and they did a throat culture. And the doctor immediately said she's a great candidate for PANDAS, and we're going to put her on steroids through IV. And literally within 24 hours, all the symptoms were gone.
Oh, my gosh.
And this is the reason why I called a month ago, is because I can imagine that there are a lot of parents out there with children. They think that they have OCD and it will take a lifetime to treat them. And possibly it's just a question of awareness, and they don't know, but maybe their kids have PANDAS, right?
What's your daughter said since? Did it feel like she'd come out of an episode, the fog had lifted? How did she reflect on that time, Thierry? Because she must have been hugely distressed as well.
Oh, yeah. Yes. It took years. And she's still now facing an anxiety problem. which is probably coming from that time. She's a great kid now. She's very, she's a 16-year-old child and acting totally normally and very happy and good at school. So I think it's all part of the past now, but I'm sure there is some part of
it's just heartbreaking.
Memory.
Yeah, it's just heartbreaking to think about that year being lost, you know, and so much distress brought upon the family. And as, Dr. Girish said, incredibly rare. But the fact that you're speaking up and saying exactly that even if there's a chance that there's a family listening today who have had some of those symptoms that you're talking about, and I think that sudden aspect must have been so scary, then to start doing some checks.
Yeah, and it's all, I was starting my new job, so I was busy at work, but my wife was there having to deal all day long with that situation, and that has been really tough for the whole family. But we're past that now. Well,
it's incredibly generous of you to come in and share your time and your expertise. I really do appreciate it. And Dr. Girish, any final words for any families listening?
So, as you said, as Terry said, it is very scary for the parents to see the child suddenly overnight, having the psychiatric symptoms, so-called psychiatric symptoms. But what PANDAS has started, I think, PANDAS was first reported in 1998, but there was a lot of knowledge gap at that time, and now we are more aware that now these type of autoimmune brain disorders can happen following other infections, including the recent COVID. We did have a lot of autoimmune encephalitis following COVID infection in children. And not only that, it is not necessarily neuropsychiatric. They can have other symptoms depending on which part of the brain is affected. So these type of autoimmune reactions can happen following influenza, following COVID, following any other regular infections. So this type of dramatic presentations in children with neuropsychiatric or neurological symptoms, we always think of autoimmune encephalitis. And PANDAS is one type of autoimmune encephalitis. Yeah.
Guys, I really do appreciate your expertise and, as I said, your generosity of time and honesty around what you went through as a family. I'm so pleased that she's come through the other side and you guys have as well. It sounds hugely distressing. And and from a personal basis, as I said, I'd never heard of PANDAS syndrome until you got in touch those weeks ago. So thank you so much. That's all about on the show here, raising awareness and having honest conversations. Girish, Terry, thank you so much. Really do appreciate your time. Breakups are rarely easy, and thanks to social media, it has become harder to perhaps let people go. Seeing your ex doing anything apart from crying in front of the TV can be incredibly painful. So why is it so hard to stop stalking their profiles? But joining us in studio, clinical psychologist from the Human Relations Institute and Clinic, Dr.Girish. We've had confessions on the text line, Girish. We've had questions on the text line. Before we start talking about looking up our exes, a little cheeky LinkedIn